This project was absolutely necessary for this community. So this hospital is one of the largest to open in England in the last 10 years, so it's a very significant scale.
The teamwork's been amazing, really. There's been no them and us, it's all just been everyone working to get to the end.
The other important aspect of the hospital is that it's going to act as a catalyst for the regeneration of the area. And already there are plans in train for major redevelopment of the surrounding area. And I think that probably wouldn't have come about without the catalyst of the hospital.
The strapline that we have is #more than a hospital. And I think that will show itself to the local population. As you come into the building and you come up to level 5 where we've got the winter garden, that's a non-clinical floor, and for me I see that as a space that the local population can utilise. The hospital itself is acute services with limited outpatients. Most of our outpatient services remain on other sites. The rest of the building, we've got the emergency departments with an emergency floor with the acute medical services down there. We then have a floor which has got critical care theatres, maternity services with the labour ward and labour theatres, neonatal unit. And then on level 4 we've got the children's wards. Sitting above that, we've got the winter garden, which is the area that we're in at the moment.
Coming from City Hospital, where I used to base a lot of my time, that site was built in 1890. It used to be a workhouse for some of the Birmingham unions. It obviously evolved from a workhouse into a hospital, and the past few years we've had to deal with leaking roofs, failing plant, etc.
My role as Managing Director incorporates being the Senior Responsible Officer for the programme, which hasn't just been the construction of this beautiful building you can see, but also incorporates clinical transformation, major workforce transformation, and a regeneration project which involves, with partners, the regeneration of the community around us.
So working with Gleeds has been fantastic on this project. We've had a really close working relationship. They've been really embedded within our client team and understood our challenges, but also been very flexible.
They've been able to get the right people in the right room at the right time and work through the problems for us.
They've been a very necessary asset to a multi-professional team with lots of partners. The staff on site have always been professional. They are part of a team. We are one. So we've worked in collaboration and forming relationships at work which are united about the end goal of opening a hospital like this, particularly in a programme that's been so challenged, is really essential.
There are urgent treatment centre that has been built, learning campuses that has been built, and also monitoring the project for next 6 months or so to understand and take the feedback of anything that we need to update or change, and taking feedback from the stakeholders using it.
There's again so much pride from our local population, and as part of the campaign to open the new hospital we recruited over 100 local residents to support the opening.
The contractor have done a great deal. They've been reporting on that every month on the benefits they've given to a local community, such as providing building supplies, providing labour for local events, and then ourselves as Gleeds, we've been involved a great deal in that as well, and also as the hospital opens we've got people on hand over the weekend helping people find their way around the building.
The highlight on this project for me is the ability to be resilient. This project has thrown so many things at the team. You name it, this project's had it.
I'm so proud of the success of moving into one of the largest hospitals to open in the UK in the last 10 years. But this is a team sport, so I feel very privileged to have worked with over 6,000 of our staff.
I've been in the industry a very long time now, and this is probably my 6th or 7th hospital project, and it's just, you can't beat a hospital project. Everyone wants to get it done. There's such goodwill. they're just wonderful projects to be involved in.
And it will feel like home almost, it's very homely, and I think that will be the difference here in this hospital.